It's real. It is real. It is very true.
The number of COVID patients keeps going up and local hospitals are feeling the strain. How a local woman found herself in a tough spot when she needed emergency care.
And Illinois is giving students mental health days. Coming up, we'll explain why many are saying this is needed. Good evening and thanks for joining us. I'm Patrice Dayton.
And I'm Rondrell Moore. COVID-19 hospitalizations continue to rise in the area. Local hospitals say they're feeling the strain as more COVID-19 patients end up in the hospital.
We want to take a look at the numbers to give you a better idea of what's happening. Statewide in Indiana, COVID-19 patients are filling 33% of ICU beds. The peak was late last year with just under 46% of ICU beds filled by people with COVID-19. There are more than 2,600 total COVID-19 hospitalizations. The peak was late November at more than 3,400 hospitalizations.
Across the state line, COVID-19 patients are filling 18% of ICU beds in Illinois. The peak was nearly double that last April. There are currently more than 2,200 COVID-19 hospitalizations. The peak in Illinois was last November with more than 2.5 times that number.
Now, emergency room overcrowding is being felt throughout the state, as we just explained, as well as here locally in the Wabash Valley.
News 10's Kit Hanley is live from Union Hospital in Terre Haute. She has more from one local woman trying to get emergency care for her mother.
Now, Rondrell, Patrice, good to have you back. Shauna Ladson commented last week on our Facebook page that her mother was admitted right back here to Union Hospital with breathing complications. Now, when she got there, she waited nearly 2 days before she could get a room.
It most definitely is. It is real. It is the ER is full. It's overwhelming.
Shauna Ladson's mother, Lori Blevins, started feeling ill at the end of August. Due to her social anxiety, she didn't seek help until early September. Friday, September 3rd, healthcare workers told Ladson's mother her lungs looked COVID-like. They sent her home with an inhaler prescription and said they wouldn't be able to schedule an antibody infusion for her until the following Tuesday.
So then on Saturday, she woke up from a nap not being able to breathe. So she was taken by ambulance to Union at this time.
Ladson tells me that was around 8 p.m. Saturday evening and that she didn't get a bed until Monday evening. Although the wait for a room was long, Ladson said that Union Hospital immediately started treating her mother.
Union wouldn't have jumped on top of it and started treating her while she was in the ER. I really don't think that she would be with us right now.
Ladson has a message for all those who don't believe this is a legitimate and dire issue.
A lot of people saying it's not real, and it is. It most definitely is. I'm not going to argue with anybody on Facebook or, anywhere else. I've been there. I've lived it the last week, and it is real. It is most definitely real.
Health officials say the best way to avoid being admitted to the ER is to get your vaccination because it could help save you or a loved one's life. Reporting live across from Union, News 10, Kit Hanley.